there, and welcome to installment 11 of Achieve Wellbeing. I'm Dr. Lisa Kirk Brown, retired Air Force Lieutenant Colonel, Doctor of Public Health with almost 30 years of experience in preventive medicine, and disabled American veteran. Welcome to the last installment of the mental aspects of well-being, creativity, and passion, where we'll discover today some of the ways creativity and passion can increase your comfort, health, and happiness, not only in your mind, but in your whole body. There's not a lot of medical research on art and healing and art and health. However, art and health have been part of our human experience and at the center of our human experience since the beginning of recorded time. With that, there's been quite a bit of new research and new interest in understanding the link between health and creativity and passion. And so today what I want to share with you is the most current information on the benefits and the types of creativity and passion that you can pursue. And I want to go through a really wonderful review article that the American Journal of Public Health published in 2010 on the review of creativity and health. So, review of current research to determine what is known about art and healing was looked at in this article. They looked at the years from 1995 to 2007. They assessed how the creative expression is as a healing process and how it's been used in both clinical and informal practice to promote wellness and healing. The review article focused on North American and European subjects who were all in their adult years, so not children, only adults, and they looked at what the medical research showed and what was currently available on creativity, creative expression, and healing process. So there's 4 primary therapies in the area of art and healing that emerge. The first is music engagement. The second is visual arts therapy. The third is movement-based creative expression. And the fourth is expressive writing. So what I want to do today is talk to you about how these 4 methods of creativity and passion can be incorporated into your daily life and what the benefits of those will be to your overall well-being, as well as what you can look for in the future from the medical literature and research. It will be changing. The review article, whenever American Journal of Public Health publishes one of these types of articles, researchers kind of fall around it and try to incorporate into their current research more research on these specific areas. So I would expect to see a lot more information in the future about creativity and passion and its link to the benefits of better well-being. Now, there's many potential benefits of art in enhancing health and wellness. You may have experienced this yourself, you may have seen someone else who's experienced, but what I'm going to talk to you about today is the review article and some of the studies that actually show statistical improvement in health and well-being and what the benefits of these different modalities are. So music is the most researched of the creativity, art, and healing subjects, research articles that were studied. It's the most common. And really, it's simply listening to music at different stages, whether you're in the hospital or if you're at a home care facility. It's really listening to music at certain key times to see if it had any type of health benefit, wellness benefit. If you play music, that is really going to increase the neural connections in your brain. It goes along with what we were talking about earlier on education and exploration. But really just listening to music has been shown to have these benefits to health. It's been shown to calm neural activity in the brain, reduce anxiety, restore the immune system via the amygdala and hypothalamus, reduce stress, control pain, and lower heart rate of patients who have high blood pressure. The visual arts are things such as textiles, card making, collage, pottery, crocheting, and other crafts using your hands, maybe sculpting or clay, and drawing. And so some of the studies focused on patients drawing or using visual arts to express their illness. And so if you have a chronic illness, along with that comes a lot of emotional distress. And when these patients were asked to use visual arts to depict their chronic illness or their condition, a lot of them had a decrease in emotional distress, which you can imagine if you deal with chronic pain or chronic fatigue or stress or any kind of chronic illness, that you most likely have some kind of emotional distress. And the patients who were asked to do these things actually had a decrease in their emotional distress. They had an increase in their focus because they were focused on positive things happening in their life. Their preoccupation with their illness was decreased. Their self-worth went up. They maintained their social identity better. They were able to express their feelings better, and their grief was able to be expressed and therefore went down. So lots of positive benefits to the visual arts. The third area, movement-based therapies. Movement-based therapies are things like dance, Tai Chi, they could be drama or theater, things like that. Maybe yoga could be considered a little bit like that if you're doing a pose that you particularly like or that feels like it's a movement that would bring out some of your best qualities. What these therapies have been shown to do is to increase cognitive functioning as well as psychological well-being, an increase in self-esteem, and perceived health status as well as physical function went up in a very key study in elderly people. So movement-based therapies have been around for years as well, and commonly we don't think of them as therapy, but I do have a good friend who invited me to a dance one time with her and her husband. It was a fundraiser for a local high school. And while we were there, we were just dancing to 50s music. We had a great time. My brother-in-law happened to be in town, and we had just a wonderful time, my husband, my brother-in-law, and my two friends. And at the end of the night, my girlfriend looked at me and said, "I needed this." And I thought about it for a little bit, and I thought, so did I. It was just so fun to dance. My son, when he was in college, it was kind of funny. He went dancing a lot at UW, at University of Washington. And one weekend we went and had breakfast with him, and the first thing he said was, "I'm going to dance every week." And I could just tell when he danced, he got a lot of stress relief out. He relieved his stress, and he had a lot of fun. And so I think there is something therapeutic about dance. Not that I'm a good dancer, but I like to dance. My grandma was a good dancer. All right, so the fourth thing is expressive writing, and I'm sure some of you that attend church or that have a psychologist, if you go to see a psychologist for counseling or et cetera, have been told to have a journal. And expressive writing, whether it's journaling or actual writing stories or writing down documents, thoughts, it has been pretty well researched. There's a gentleman named Panabaker who's the expert on expressive writing research in health, and he has found pretty significantly that pain is better controlled and pain severity is lessened by journaling and using expressive writing. They also discovered that emotional distress of patients who have gone through some type of trauma, whether it would be in their childhood or adulthood, that simply writing down the event and maybe journaling thoughts about it that weren't able to happen in real time. Obviously, if you're in a traumatic experience, whether it's a fire or something worse, you're not able to write down or emotionally process that in real time. And so this journaling or expressive writing has really been shown to help patients improve their ability to manage that event and to control post-traumatic stress disorder, which happens, if you've been through a trauma, happens at varying degrees over our lifetime and may always be a little bit in the background. There's lots of varying opinions about that, and I'm definitely not an expert in that area, but I have had post-traumatic stress disorder, and I do know that it never really totally goes away. You just have to learn to manage it better. All right, so there are limitations to this study, and there are limitations to the things I said. It's not extremely well understood at this point what the true benefits or if there's any risks to creativity and passion. However, I would strongly encourage you to give creative arts, and especially give creative arts a try, especially if you're dealing with, like I said, chronic pain, chronic health problems, chronic stress, depression, trauma in your past, or anything that is affecting your health currently in the present day. It's also something to just keep you well. So like we're talking about dancing, my girlfriend that needed that dance weekend, that dance evening, she doesn't have any of those things, but it really had some benefit to her outlook and her energy level and her daily experience. And so I would highly recommend it for those of you that are watching this video. All right, so thank you again for watching Achieve Wellbeing. I really appreciate your time, and I look forward to the next installment. We'll be halfway through Achieve Wellbeing. We'll be halfway through all 24 installments of Achieve Wellbeing, and there'll be a few interviews interlaced in there, so I plan to go through the end of the year, roughly every 2 weeks. There's 52 weeks in the year, so I have a couple weeks where there's a 3-week break, but not more than 2, so that's good. And then next installment, we're going to be looking at the spiritual aspect of well-being. And I'm going to be introducing the 3 elements of the spiritual aspects of well-being. I can't wait to do that with you. It's a really deep part of achieving well-being, and many of you have lots of experience in this area. But I look forward to sharing that with you next time, and I hope you have a great couple weeks. Thanks again for watching, and take care. Bye.